This video is presented by TRACS WA, Training Centre and Subacute Care. In this scenario, 47-year-old Andrew has undergone a recent below-knee amputation due to chronic osteomyelitis. Today he's meeting prosthetist Brendan Cahill to discuss the options available when transitioning to a definitive prosthesis.
You've been wearing the prosthesis for a little while now. How are things running?
Not too bad. I'm back up to like the liner, 5 thick socks and 3 thin socks. So it really feels like it's packed up and I've got very little movement. I can't bend my knee back. Still, I feel like it's a bit rubbing somewhere inside it as well.
Yes.
So I wouldn't mind having a look at that.
Almost undoubtedly, when you add lots of socks like that too, we start to get some different pressures.
Yep.
Your knees, your bones haven't shrunk, so it's usual that we get quite tight across your knee when adding lots of socks. It's a common problem to have sort of pressure when adding so many socks.
Yeah.
So let's have a look and see what we're seeing inside.
So this is sort of what's happening with it at the moment. It's so loose.
You can pop out without doing any of that. Okay, all
Yeah.
right. We're actually seeing a really high concentration right in the middle here, which is not so good. I'm also seeing some reddened marks down the bottom of your shin bone, which is not what we're looking for. We're looking for it on the sides of the prosthesis more.
Yep.
If I look at this side of your prosthesis, it's quite even, but quite a lot of high pressure areas.
Yep.
And then on the other side, again, even, but a lot of high pressure, and down the bottom, we're getting quite a lot of pressure down the bottom of the...
Yeah, I noticed that the other day, and it looked like when I changed the liner, it actually looked like it had weeped.
Yes.
But I'm not sure that it doesn't look like it's open, but it could have just been like dead skin.
So what it looks like your skin is struggling a little bit to cope inside the prosthesis from a point of view of moisture.
Yep.
So your current prosthesis, you're wearing a gel sock. This is a cotton sock with gel inside to increase cushioning, but it does mean that it's an airtight situation that doesn't wick sweat and moisture away.
Yep.
As you said, you're wearing 1, 2, 3, 4, 5, 6, so 6 or 7 socks.
Yep.
with that.
Yep.
Inside the peel-out liner. Now, another common thing that we'll see as we start to lose fit inside a prosthesis is the powder that you're wearing inside there. See how you can't, you can see where your leg's making contact. The powder down the bottom is showing us that there's a gap. Now, as your leg shrinks away, that's not unusual. We start to lose some of the soft tissue down the bottom,
Yep.
but that's also showing us that we're hanging up a bit off the top as well.
Okay.
So what that often means is even though you've got all of those socks in, we're actually probably pushing you up a little bit too much.
Oh.
And we could add some packing to this liner to change the shape of this and potentially reduce down a sock or two.
Cool.
To get better comfort, better control. But undoubtedly with gel sock, 6 or 7 socks, we're to the point where we need to move to the next stage.
Okay.
So, your stump has changed enormously since post-amputation, when you were quite bulbous and quite wide down the bottom. So you're now getting a bit more of a conical shape. We can start to see the flares of your tibia and a bit more of a shape where we can see the fibular bone on the side here. And that's a lot more of a typical below knee stump type shape.
Okay. Cool.
As I had said to you though, it does look like your skin is just struggling a little bit with the pressure of wearing the prosthesis, but that's also too, you're wearing the prosthesis how many hours a day now, Andrew?
Anything up to 17, 18
Okay.
hours.
So you're getting up in the morning, you're putting it on, and
It
you're
stays
wearing
on
it
all
all
day.
day.
Yep.
You're now returning to work, as I understand?
Yep.
Okay, so what that means is that your leg is having to cope with vastly increased amounts of activity, and you're on your leg for hours at a time, you're doing more walking. So what we need to do is we need to help your leg cope with that pressure by utilising a different system. Number one, a socket that's going to fit better.
Yep.
But number two, potentially try and find a system that can help your skin cope with that a little bit better.
Okay, cool.
Sweat happens when the body's losing temperature,
Yep.
and it brings moisture to the air for evaporation to reduce the temperature.
Okay.
So what we see in a majority of clients is when we're wearing a well-fitting silicone or gel liner, which means that it's completely airtight, that the body adjusts to that by reducing the amount of moisture that it brings to the surface. In probably 80 to 90% of amputees that I work with, a good fitting silicone or gel liner will reduce the sweating considerably after a few weeks or months of wearing a liner. Initially, when we do put it on, it'll feel a bit sweaty and a bit clammy, but in most cases that sweating drops right off.
Yeah.
Clients with that sweat a lot, the cotton socks will absorb that and wick that away, but the socks do get damp, just like a sock gets damp inside a shoe.
Sure.
And what we're seeing is on your skin is some classic signs, especially in this little fold here, that's been moist. And skin that is moist softens and doesn't cope with pressure as well.
Okay.
So I think it would be a really good move for us to move to a silicone or a gel liner on your skin.
Yep.
So potentially a liner that might work is a liner such as this one here. It's a silicone liner, but it's called a Smart Temp liner that has an additive in the silicone that helps to reduce the temperature.
Yep.
And it takes some of the temperature away from your leg and into the silicone.
Yep.
Helping your skin to cope with it and reducing that sweat. Now this particular liner has nothing on the bottom, it's called a cushion liner.
Yep.
So we would generally fit this type of liner with a suspension sleeve with a suction type system. We can get a liner like this with a pin down the bottom that will lock into a socket with a pin lock system. And what that will allow us to do is to come back to a prosthesis with this liner and probably one sock, which will mean that you'll have greatly decreased bulk around the knee.
So we're talking the socket, sock, and this. That's it.
I think so. So we potentially could use a peel-light liner again and that would increase the adjustability we've got.
Yep.
But as you have decreased in size and are getting a bit more stable in that size, we could just try this straight into a socket, so this liner taking the place of the peel-light liner, and then obviously we could have a sock or two as we need to over the top of this. What you'll find is with any of these liners that grip to the skin, for example the bottom of this liner here, and put my hand here, when you bend your knee, you'll see how much distance it comes. So basically as your knee bends, the distance over your kneecap increases, and what that can create some real tension on your kneecap. Yep. The design of this liner is such that this white panel on the front is an increased stretch, and that it's designed to decrease the amount of pressure on your kneecap. Okay. Albeit when you do bend your knee, if you can bend your knee for me, you will feel some increased pressure on the kneecap.
Yep.
There. So the process for providing such a prosthesis is similar to the ones you've been through in the past. We take a plaster cast, but we take it over the top of this liner.
Okay.
The reason being is I need the shape of your leg inside the liner to create the prosthetic socket.
Yep.
Because we need the volume of your leg inside the liner, but also the shape of your leg inside the liner, which changes when we put this liner on.
Yep.
So we'll take a cast of your leg inside the liner, and then go through the process of fitting a diagnostic or a check socket to check the fit of the prosthesis, and then rolling through to a permanent fiberglass socket once we get that fit right.
Okay.
The difference between a definitive suction socket and the interim suction socket that you've been wearing is that we actually add a valve to the definitive socket. So what that means is once we get the socket fitting onto your leg, I'll use your old socket as an example with the liner taken out. So we have your leg inside the liner, potentially a sock or two.
Yep.
Your leg goes into the liner, as you can see there, there's a fair bit of difference in size. When the sleeve then goes up on top, we then incorporate a one-way valve into the bottom of the socket.
Yep.
That as you step onto the prosthesis and put pressure on, air is expelled through a one-way valve but can't re-enter the system. With an airtight system, we then have a suction grip, and what you'll find is that we should get a really positive suspension of the prosthesis on your leg. The other thing to talk about is the change in componentry. So what we're going to do is we're going to look quite carefully at that foot component and choose a foot that's applicable to your weight level and also your increased activity level. So what that means is it's going to be a foot that's going to be a little bit stronger to cope with your increased weight, but with a bit more flex in it, if you like, that will allow you to increase your activity, and it will work a little bit better when you're walking a bit faster. And it just means that the foot will do what you need it to do. It is an important consideration that ongoing, if you were to lose a lot of weight or gain a lot of weight, it's a really important detail to feed back to myself as your prosthetist. If a lot of weight is gained, it can mean that a foot and the rest of the componentry is not rated to be strong enough for what you're doing. Or vice versa, if you are able to lose a lot of weight, it means that the componentry can actually be a bit too stiff and not providing the function that you need it to. So it's important that we keep you in that sort of slot of componentry matching to your body weight and activity level. And that'll be something that sort of rolls on as we roll through the years and go through different versions of the prosthesis, because moving to this definitive prosthesis, it's called your permanent prosthesis, but they have a lifespan of 2 to 3 years. And so it'll be something that you'll see me ongoing to keep adjusting and then keep replacing as we move through. So from that point of view, we'll be picking a foot component that's got a bit more of a dynamic aspect to it, a bit more spring and a bit more energy return. And the idea is that as your body weight loads that foot, it acts a little bit like a spring, stores a little bit of energy, and then as you move through and unload the prosthesis, it returns a little bit of energy to your gait. Studies have shown that walking with a below knee prosthesis can be equated to about 40 to 50% more energy to walk. And some of these components have been shown to significantly decrease that, and especially as you get to faster speeds of walking. Obviously, from a safety point of view, the more you're putting into it, the more important is that it's actually rated correctly for your weight and your activity level. It's often the case that we need to fine tune and readjust things. So generally speaking, in the next couple of years, we'll touch base with you every 3 to 6 months, depending. Of course, if you have any problems at any stage, you contact us. If you need socks, if you need sleeves, if you need liners, if you have a problem with the fit, etc., you contact your prosthetist and get that addressed. Getting addressed sooner rather than later is always a good thing. It's much easier to fix a small problem than a large problem, and it will keep you working and keep you ticking along in normal life more successfully. So did you have any other questions?
The whole process of getting the whole thing, the definitive leg built, how long is it going to take?
It does take time. So generally speaking, when I take a cast of a prosthesis, it's a week or two before we get to a diagnostic or a check socket fit, which is a temporary socket for us to evaluate the fit of the prosthesis. It's a bit more adjustable. It's also made from a see-through plastic so we can actually see what's going on. We'll often test that for a day or two outside of the clinic so that we can actually get a better snapshot than half an hour in the clinic of wearing it. It's important that we get that socket fit right before we move to the fiberglass or carbon fibre socket, because they're much less adjustable. Once we decide we're good to go on the final fiberglass socket, that will take another week or two to manufacture. And then when that's fitted, we'll then see you for a review at 1 week, at 2 weeks afterwards, just to ensure that the fitting is right. It's in the early days of a new socket that we're at highest risk of a skin breakdown. I often describe to people it's like a new pair of stiff leather shoes. Even if the fit is perfect, if we overdo it in the first couple of days, we can have a problem. So it's really important to sort of wear in a new prosthesis. And if you're having problems, don't push it too hard. And by all means, let myself know so that we can address and fix any problems.
TRACS WA would like to thank the staff and management at Sir Charles Gardner Hospital for their involvement in this project. This project received funding from the Australian Government.